So this screencast 3 is going to be just covering a little bit of information about some of the models and theories that health promotion is based upon. So are we talking about a model or a theory? And there are several different ways of looking at it, but the clearest way, I think, of thinking about whether it's a model or not is it's a visual thing. So if you've got a model, it's a visual thing, a way of looking at it that helps us to understand how we think health promotion works. So it helps people to understand how they think health promotion works. So BT, Tones and Tannehill are all researchers who came up with these models to try and help us understand health promotion. Theory is kind of knowledge about what we think is going to happen. So what they should do is help us to understand what's going on. And theories should be tested in research. So we're expecting a research project will test whether a theory actually works or not. And the whole idea is trying to explain what's happening with the people involved in that health promotion activity, what's going on, and how do we understand what's going on. So there should be some theoretical underpinning into all the planning that we do, and we'll look at planning later, and our implementation of the project that we are doing and the evaluation of it. And we'll look at evaluation later on as well. So just to give you an example, Tones is an author that's done loads around health promotion. And their understanding is that if we have a healthy public policy and we have education for health, that is going to lead to an improvement in health. So that is very much about supporting people to gain control over their own health. And it's very much the theory behind it is, let's empower people. We'll tell them how to do things, we'll educate them, we'll put the right policy in place, and ta-da, we have wonderful health. So that's their understanding and how they would plan things through. We then have a connected but slightly different subject of models of behavior change. And there are absolutely loads of them. And I've just given you a list of a few here. And what they're trying to explain is, if we do this, what impact does that have on behavior? And if we're trying to promote people to health-related behavior change, to change their behavior, to improve their health, to improve their diet, to improve their health, to improve their physical activity level, how do we know that that's going to work? So these models or theories, and they seem to be a bit interchangeable on which you call them, you will hear about in different areas. The one that I think you'll hear most about is the stages of change model. But what you actually find in dietetics is there's very little evidence base for these. But we really do need to understand some of that theoretical background. So if we're going to change something and improve something, we think, what are we actually doing? What's going to make the difference? And why do we think that's going to work? So I've given you some places to go to look at more theories if you want to. But I'm going to focus on one or two things that I think are most helpful. So the behaviour change wheel comes from the Centre of Behaviour Change down in University College London. And it incorporates a model which I'm going to show you more about, which is the COM-B model. And it's basically you've got the individual in the middle and all the different aspects of their life. And then these factors, the COM-B, capability, opportunity, and motivation. And then on the outside, you've got all of these bigger picture things that might change, like legislation or regulations or fiscal measures, which are to do with money. So if you look at this model on the web, on the Behaviour Change Centre at UCL, you can actually see what each of these individual things mean. You can get a definition, and you can also get some examples. And the reason I'm focusing on this is because it's mentioned in NICE guidance on behaviour change. So that's what they're using. They're not saying that any particular one of those other models I've mentioned is the one to go for. They are suggesting that we look at things in this particular way. So let's have a look at this. It's quite simple, but quite easy to apply model called COM-B, and they call it a framework. Clearly, it's visual, you can see that. The key thing I want you to have a look at here is the direction of the arrows, so that you can see each of them are interlinked in some way. To make a change in behavior, but also a change in behavior, you can see links with the other things as well. So I'm going to go through each of them individually to give you a bit of an idea of how that might work in dietetics. So let's start by looking at capability. So this is all to do with the individual. So someone's psychological, physical capacity. So someone who might be able-bodied or someone who might have a disability may have a different capability. Someone with poor mental health may have less psychological capability at a particular time. So it's very much about the individual. That includes them having knowledge and skills. And you can see here, there's a little bit of the model, that capability, if you improve capability, it can influence motivation. If you decrease capability, which changes might happen to someone, they may have a mental health dip, or they may be injured or develop a disability, then the motivation may go down. Similarly with behavior. So this is to do with our ability to understand, comprehend, and do reasoning, and our physical capability to do something. So, for example, we might provide dietary advice or education which improves someone's comprehension and their reasoning. So we're improving their capability, which makes it easier for them to do things which is more motivational, and they're more likely to change behaviour. We might do a supermarket tour, showing service users where to buy and find recommended foods. We might actually do some practical sessions like cook and eat sessions, or we might provide links, information where people can get more social support, self-help groups, for example. We can signpost people to things that are going to increase their capability. There's lots of different things that we can do, but we also need to think of those negative things that will have a negative impact on capability. So someone with a learning disability may have less capability in certain areas. Someone with a physical disability, poor mental health, or if we are providing information that doesn't meet our service users' needs, then we are not going to be helping their capability. So there's lots of different things that we can think about with capability, and lots of that relevant to dietetic practice. If we look at opportunity, we're looking at everything that's external to that person. So this includes our wider determinants of health. So opportunity can be influenced by and influence behaviour as well as motivation. So it's linked with those things. So if we change behaviour, we may have more opportunity to do things. So here, I'll mention community development again tomorrow, but that's a way that we can make things more available to people. Therefore, so if we make healthier food more available, people have a better opportunity to eat it. So if we make things more accessible, food banks, for example, we might provide people access to information, either through group education, webinars, websites, and those kinds of things. We might provide resources that enable the service user to do things differently. So there's all sorts of things that will change opportunity for people, which may then enable them to change behaviour. But if you think about society at large, and you think about, for example, shops closing in small towns, some of that opportunity may be taken away if the only ways that people can access healthy food is by getting on a bus to an out-of-town supermarket, as opposed to walking around the corner to a greengrocer's, then actually their opportunity shrinks. So these things are in a constant flux. Motivation, as all the things that energize us and direct us to do certain things. Some of it conscious, some of it unconscious. And what we need is that the motivation to the target behavior, so eating 5 fruit and veg a day, is more important to that person than other things that might actually say, I prefer to spend my money on a Mars bar. So we've got to help people with improving their capability and opportunity so that their motivation is easier. We can change that balance and make people feel that they can actually do things. So if they feel they can, they're more likely to. So we need to be realistic with the goals that we set people and checking out whether that actually works for them. We might monitor their progress, and that's something that, particularly relevant to yourselves in the position you're at the moment. You do perhaps do a lot of monitoring for people, but positive feedback is highly motivational. So if people think, actually, I've made that change, it was challenging, but I'm achieving something, then they are more likely to continue. So things that can negatively affect that might cause cost of things, make things people aren't motivated because actually it's too big a cost, and I don't just mean finance, I mean through effort. So if we set somebody an unrealistic goal, that's demotivating. If people don't understand why the change is needed, if we've not perhaps explained the link between the dietary change that's being recommended and the outcomes, well, why do we have to do that? What's it linked? What good is it going to do? So people need to have that level of understanding. If they can't find the food that we're recommending, they're going to be demotivated. And habits, of course, are quite difficult to change. So we need to be really mindful of that as well. Motivational interviewing can help people, but that's a very small part of our practice. It's an important part, but the kind of thing that I expect would be developed later on. And we will discuss that more in the next module, Skills for Dietitians. So, going back to your health promotion activities that you were thinking about, ask yourself whether you are affecting capability, opportunity, motivation, or behavior. And it could be more than one. You could be doing that in several different ways. But also to ask yourself the question, is there anything that might be having a negative impact on those things? Something that might not be useful for an individual, something that might not be accessible, something that might actually be beyond the reach of an individual. So have a think about the activities, or maybe just choose one or two, and ask yourself the question, how does this link with COM-B? What's it influencing, either positively or negatively?